Yes, ma'am, I'm ready.
Okay. Okay, just a second, please. So if you've read and understood, considering its surgical anatomy station, please tell me in the picture on the right, left-hand side, please, or your right-hand side. What are you looking at, please?
I'm looking at the right leg.
Okay, can you
With,
identify which side is it, please?
this is right side.
No, how come? Have a look. It's the left leg.
Left side.
Please. Yes, it's the left leg. Can you identify this bony prominence labeled A?
Yes, this is tubular tuberosity.
Can you identify structure B, C, and D?
Structure B is deep fascia of the anterior compartment.
C and D, please, quickly.
D is extensor hallucis, extensor digitorum longus.
And C?
C is, let me zoom.
Okay, please, next question. What are the symptoms? Remember, symptoms and signs if a patient presents with anterior compartment of the leg syndrome.
Patient will have paresthesia uh, and severe pain on dorsiflexion, pain out of proportion to on dorsiflexion and pulselessness.
Okay, please tell me, how would you classify the fascicle or the muscular compartments of the lower leg? And kindly give their principal blood supply as well of each and every one.
The leg has three compartments: anterior, lateral, and posterior. The anterior compartment is supplied by anterior tibial artery. Posterior is supplied by posterior tibial, and the lateral is supplied by the peroneal artery.
Yes, but you didn't tell me the
Different muscles.
components. Yes, of the compartment.
Okay. The anterior compartment consists of anterior tibialis, extensor digitorum longus, and extensor hallucis longus, along with peroneus tertius. Posterior compartment has superficial and deep compartment. Superficial consists of soleus, gastrocnemius, and popliteus. Plantaris, and the deep posterior compartment is consists of flexor digitorum longus, flexor hallucis longus, posterior tibialis, and plantaris.
Can you please tell me again, in which compartment is the extensor digitorum longus muscle located or found?
Anterior compartment.
In which compartment would you find tibial nerve, or in which compartment does the tibial nerve run?
In the posterior compartment.
If you could look at this image here on my right hand side, can you explain what are you looking at?
I think I'm looking at an angiogram showing
contrast. Yes, angiogram of the lower limb, right lower limb.
Right lower limb showing A is the popliteal, and down below is anterior tibial, B, and C is posterior tibial, and D is peroneal artery.
Can you please tell me what are the signs again and the symptoms if a patient presents with acute ischemic limb?
Patient will have out of proportion pain on dorsiflexion, paresthesia, tingling sensation, or pulselessness.
And another P? Pallor.
Uh,
Okay.
pallor.
This structure D, please tell me in which compartment does this run or is found?
In the lateral compartment.
Okay, can you please tell me what are the terminal branches of the structure labeled C?
Okay. Sorry, ma'am, I don't know this.
Okay, when you don't know it, say I'll come back to this later. Okay,
I'll come back.
please tell me, what is the origin of the arteria dorsalis pedis? Or in other words, it's the branch of which vessel,
It's the branch of anterior tibial artery,
right?
which
Okay,
gives two branches at the ankle, the medial malleolar and the lateral malleolar, then which further
right.
gives branches to the tarsal bones, to the medial and lateral tarsal arteries, and then it gives two branches, one to the deep plantar artery and make an arcuate in the
Okay,
dorsal aspect.
good. Thank you. Can you please tell me what is the origin of the sural nerve? The root value and where exactly it comes in picture.
On the lateral malleolar side,
All right.
on the lateral compartment,
And
and
which
behind the
are you trying to tell me that sural nerve supplies the lateral compartment?
not yes, sensory
Sensory
is
supply
the
of the lateral compartment.
lateral foot and the lateral.
Right. Please tell me, you could see structure C here, right? Okay, but I want you to imagine that this structure passes behind the medial malleolus. Between
Yes.
which two structures?
Extensor hallucis longus and flexor digitorum longus.
Okay, and now if you could tell me, here is one structure, this strap kind of. Please identify the structure and tell me its attachments.
Strap kind of.
Yeah, this one. What structure is this?
Ma'am, these are ligaments of the ankle.
Are
Uh,
you
and
sure?
it is on the lateral aspect. So okay, yes, this is the extensor retinaculum.
Yes, please, attachment.
Yes. Attachment, extensor retinaculum has tendons that pass through it of extensor digitorum longus, extensor hallucis longus, and uh, tendons of uh, sorry,
All right. What are the
fibularis. Yes.
structures which passes behind the lateral malleolus?
Okay. Behind the lateral malleolus are peroneus uh, brevis, peroneus longus, and sural nerve.
Okay, time went. Thank you. All right. Here, if a patient has an accident, there is injury of neck of fibular fracture, etc. How could a patient present? What would be the sign and symptoms with which patient would present?
Patient would have sensory loss at the dorsum of the foot,
And
and patient will have foot drop.
yes,
The patient will not be able to dorsiflex his foot.
right, please. If you could tell me the difference, how would you differentiate that with a sciatic nerve injury?
In sciatic nerve injury,
Yes,
patient would also not be able to do the hip abduction.
right. In addition to what
But
you've
in
already
the
told me. Very good.
yes,
Okay, thank you.
thank you, ma'am.